You might already have money set aside that can pay for cash-based healthcare and not even know it. Today in this video, I'm going to cover what HSA, health savings account, and FSA, flexible spending accounts are, how they work with cash-based care, and exactly what to do before your next appointment. Most people assume cash-based care means paying entirely out of pocket with no tax advantage. That's not the full picture. This video is going to go over HSA, FSA, and pre-tax dollars that often can be directly used with cash-based practitioners. I'm Susie Rains. Welcome to the Health Over Wealth in the United States channel. And on this channel, we talk about all things cash-based practitioners, being able to supplement what you're doing in insurance, either completely removing it or using it as a hybrid with cash-based practices. So this video is all about health savings accounts and flexible spending accounts. What is a health savings account? And these are two different things. They come from your employer. Most people who are self-employed do not have them, but you might if you set them up, if you have a small team and you're doing that with your team. I don't have them, but I did have them when I worked in corporate. Health savings accounts are different than flexible spending accounts. I'm going to go over the differences in the video. So health savings accounts paired with a high deductible health plan, HDHP. There's some technical terms, but I'm just going to go over like basics. And I'm going to say before we go any further, make sure you check with your benefits administrator at your job with your health savings and flexible spending accounts to make sure what the rules are for your specific employer, because they can be different. I'm going over what's federal, what the federal government says is okay for tax purposes. So what you can have non-taxed on and how you can use this to get cash-based wellness care. So health savings account is paired with your high deductible health plan. I'm reading notes, by the way, because I want to make sure I don't miss anything. Pre-tax dollars means that the money rolls over year to year and it doesn't expire. You own your health savings account. It follows you even if you leave your job. So you can actually use that money to go into a retirement account or investment account or something like that to keep the pre-tax happening. Again, check with your employer, benefits administrator, on how this works if you're going to be leaving your job and you want to take your health savings account money with you. It can be invested just like retirement account once your balance reaches a threshold. So once you meet a certain amount of money, then you can roll that into a retirement account, which then is, again, not taxed until you take it out. The 2026 contribution limits based on the IRS, this came off of the IRS standards, and they actually raised them from 2025. So self-only coverage contribution limit means this is how much money you can put in the calendar year. $4,400. Family coverage, $8,750. And I don't know what a catch-up contribution is for people 55 plus is an additional $1,000. So I'm wondering if, I'm guessing this isn't something I researched, so I would recommend you research it. If you're over 55, it sounds like you can put an additional $1,000 in over the limit to catch up, meaning catch up on saving that money. So research that, because that I'm not familiar with. So you can research it for yourself. So to qualify for the health plan, you have to meet your high deductible health plan minimums. So minimum deductible is $1,700 for just yourself, $3,400 for the family. Out-of-pocket maximum is $8,500 self, $17,000 for your family. Health savings account funds can be used for any IRS qualified medical expense, including cash-based services. So what that means is you have free money right now if you have a health savings account, or if your employer offers a health savings account and you are not contributing to it. So if you're paying an insurance premium, so you have insurance, you're paying a premium, but you're not putting money into your health savings account, you're losing out on tax-free money because you don't get taxed when you put that money into your health savings account, and then you can use that for cash-based wellness if it fits into an IRS qualified medical expense. And I'm going to go over what some of those are a little bit later in the video. So stay tuned. We're going to get a list of those. That is the health savings account. Now, what is a flexible spending account? This one's a little bit different and it has different qualifiers. And again, check with your employer, check with your benefits administrator. Which one do you have and what do they use and what are the rules around it? So, flexible spending account is an employer sponsored benefit. So, your employer is the one that does this. It uses pre tax dollars. So, again, you put the money aside that's before taxes. So, you're not getting taxed on your income. And it does not require a high deductible plan. So, you don't have to have an insurance plan to have this account. It's just a separate account that you can put pre tax dollars in. It has a use it or lose it structure. So, you have to use it within the calendar year, and your employer will tell you when the deadlines are for things. I'm not sure if it's different for depending on the employer and what benefits you have. So ask them, when do I have to use up this money that's pre-taxed? So 2026 limits, maximum contribution $3,400, maximum carryover $680 if your employer's plan allows it. Now, I'm thinking back, this was years ago, so I'm sure things have changed, but one of my employers actually allowed us to carry over the money from year to year, but there is a maximum carryover, and it looks like for 2026, that maximum is $680. So if you put $1,000 in it, you have to spend all of it by the cutoff, or if your employer allows carryover, you can't carry over more than $680. Dependent care flexible spending account, it's separate from a health flexible spending account. So dependent care is going to be for childcare, I believe. It works for that if you're taking care of an elderly parent or a family member. So there's certain things that qualify for you to use this money, but it's dependent care flexible spending account, not health care flexible spending account. So make sure you know which one and if your employer does one or both. And I'm not going to go into the limits on that because we're talking about healthcare. We're not talking about dependent care. So just ask your employer about that. Next, we're going to talk about how do these accounts work with a cash-based wellness care. So it depends on the type of service and it depends on if the practice allows for it. So I'm going to tell you this. If you're with an employer who has either an HSA or an FSA, they may or may not give you an actual card. So you might have a debit card or something that looks like a credit card that has your money on it, and you can just give that to the cash-based practitioner. They'll run it and it's paid. But on the backside, the owner of the card has a report. So they could reject a payment of something that doesn't qualify. So you might get it paid and then something comes back later. This is all electronic. So there are things in place. I'm not familiar with 2026 if it will automatically authorize with the card or if there will be a reconciliation later. So definitely talk to your benefits administrator and find out the details specifically for how they pay this out. The other thing you can do is you pay cash yourself and you get either a super bill or a receipt from your cash-based provider, and then you submit that to get reimbursed. So you basically pay yourself back from your health savings account or your flexible spending account. There is no insurance. No insurance is involved. Generally, and again, these are general categories that are covered under these two plans: physical therapy, chiropractic care, mental health services, primary care visits, nutrition counseling when medically necessary, lactation consulting, and midwifery. I know some of it does eye care and some of it will take dental care depending if it's medically necessary. Again, these are medically necessary services. You may have to get a letter of medical necessity, LMN, for functional medicine, health coaching, some holistic or integrative services. Typically, what is not covered with HSA or FSA is life coaching, general wellness services, gym memberships, fitness memberships, and most energy healing modalities. So The key takeaway of this is ask the practitioner if they can provide an itemized receipt, super bill, or a letter of medical necessity if you need it to get reimbursed. You can also ask them if their system is set up to accept your debit card for health savings account or flexible spending account. This is something they'll already know if they're set up or if they're not. And then you can start using this pre-taxed money. I just want us to pause here for a minute. For those of you that don't know or don't understand, you don't pay taxes on this money. It goes into your account before you pay taxes on your income from your employer. So you don't pay taxes. So you're taking non-taxed money to pay for your health care. That's a big deal. That is huge. That's lowering your taxable income, which means you pay less taxes at the end of the year. So if you're not using this, I just want to say right now, comment below if you have an HSA or an FSA if you want to, or what your experience is around using it, or if this is brand new to you and you're thinking, I need to use this. My company actually has this and I didn't even know what it was. I didn't even pay attention, or I could have been using it. Comment, let us know what's happening for you because it's a big deal. It's a lot of savings. You could save thousands of dollars, especially if you're doing family on your medical care. All right. It's a lot of information. I just gave you a lot of numbers and words and jargon and all that. Take a deep breath. We'll take a nice deep breath in. And we're going to move into what are the practical steps before you have an appointment? So confirm that what you're being seen for is HSA or FSA eligible. You can reference what the IRS publication 502 has the official list of qualified medical expenses. I'm going to say that again so you can go look it up. The IRS publication 502, the official list of qualified medical expenses. If it's on that list, you can pay for it with HSA, FSA. Ask your practitioner for documentation. An itemized receipt or super bill is usually sufficient. If the service may need additional justification, ask about the letter of medical necessity. If you're in a gray area, not really sure if it's covered or not, just ask them if they can do a letter of medical necessity. And if it's medically necessary, they'll have no problem doing that for you. You want to pay and keep your records. When you use your HSA or FSA debit card at the time of payment or pay out of pocket to submit for reimbursement, hang on to your receipts and all your documentation for that visit. Your plan administrator may ask you to verify expenses. So keep all of the receipts, keep all the documentation. When in doubt, ask your plan administrator before your appointment. So say, I want to make an appointment with this cash-based provider and I've double checked the list, but I'm still confused. Is this covered? Ask that question because you can find out. And eligibility can vary by plan. So just make sure that you check with your plan administrator before you make an appointment. Why does this matter? I just told you, you're going to save thousands of dollars that you may not even realize you have access to right now. So check with your plan administrator as soon as you can. Many people avoid cash-based assuming that there's no way to offset the cost. That's a big one. People just disregard cash-based practitioners because they're like, I don't want to pay out of pocket. I have insurance. I'm just going to go use my insurance. They may have access to this, not even knowing that they're actually saving tax dollars to use cash-based over using their insurance. So think about that and look at it. Look at your plan and see what you have. HSA and FSA accounts change that. They make it really easy to use cash. Up to what you can use for your limit, use it. Make sure you're taking advantage of that. Pre-tax dollars reduce the effective cost of care because you're not paying taxes. It's not taxed. So you're saving money by using this with a cash-based practitioner. Using these accounts with your cash-based practitioner means you decide where the money goes, not your insurance company. This is about you taking back your ownership of your money and where it goes and how things are paid for in your wellness plan and your healthcare for your family, for yourself. You get to decide where this money goes and what it's used for. And in the previous videos, and I'm always sharing this, Cash-based practitioners spend more time with you. That's an advantage. They're there to help you get results, actually work with you on getting results, not just giving you a prescription, and they care about you. So all these things combined, that's where I want to put my money. So if you have money with HSA, FSA, use it with a cash-based practitioner. That is a beautiful way to use that. Most people are not used to this, so use it. All right, quick recap. HSA and FSA funds can be used for cash-based services. Know which ones qualify. Ask for the right documentation. Check with your plan administrator if you aren't sure. And how do you find a cash-based practitioner? How do you find somebody that takes your HSA, FSA? That's where the Centered Care Directory comes in. Click on the link in the show notes and you can look for a provider in your area or even somebody who does all states. That's possible that you can use it for that too. So check out the directory, click in the show notes to see where that is in your area or if it's virtual. If you're enjoying the channel, please subscribe. It helps the channel grow and it helps more people to find us so that the information can get out there for the needs of the people. And the next sets of videos I'm going to be going over, we're going to be talking about different specialties and ways that you can use cash-based to help enhance what you're doing on your health journey. So stay tuned for those videos. And I believe that you're going to see a recommended video up above me or beside me or somewhere around me. So click on the link to watch that video. We'll see you next time.